Hello and welcome to Health Matters on Channels Television. Thanks for joining us. I am Mary Alale Yusuf. Fibroids are muscular tumors that grow in the uterus, also called the womb. These growths are very common in women, affecting up to 80% of women, somewhere between 20 and 80% by the age of 50, but are usually benign or harmless. They come in all sizes, singly or in multiples, and are generally without symptoms. On the show today is Dr. Ayodeji Olamijulo. He is a consultant gynecologist and obstetrician at the Lagos University Teaching Hospital. You're welcome to the show, sir.
Thank you. Good afternoon.
20 to 80% of women. That's like almost everybody in some places. But what informs the disparity?
Well, thank you very much. As you acknowledge, the prevalence is quite wide, but it depends on which studies you are talking about and how the figures have been arrived at, which population. There's definitely a variation in terms of population type. It's commoner in blacks, for instance, compared with white, but also it depends on how well you have looked for it. Are you using just clinical judgment or about women who presented in hospitals or facilities, or are you screening the populations using, more sophisticated methods like doing ultrasound scan, or sometimes even using autopsy figures, where
autopsy
everything,
figures?
Yes.
Okay, so they do check them after they've passed on?
That's correct. So,
and that's how they found out
that there are many more people who have fibroids than, were actually known when they were alive. So that's why you have the very wide variation. But I think for practical purposes, one could say that, it's common. It affects about 1 in 5 women in their reproductive age group.
But that's still a lot of,
that's
of
still
women.
quite common, yes.
Is there any reason why it affects black women more?
Well, one has to, go back to genetics, even though the particular, gene characterization has not been pinpointed. But, it's also known that it's commoner in certain families where you have either the parents, and siblings being affected. So there, seems to be a strong genetic or hereditary component to it.
Are there any other risk factors apart from being black and then a familial, hereditary?
The other risk factors that have been identified had included, women who are of low parity, women who either have had a delay in starting a family or who have, had issues with fertility. It's commoner in women with infertility. However, the question then comes, which one comes first? Is it the chicken or the egg? Was it because they have fibroids that
they're having infertility?
Exactly. Or was it because they had delayed starting their family career that had led to, development of fibroids?
And that is not clear yet?
It's not clear.
Because a lot of people say that, it's like a womb, a starved womb crying.
That's correct. In the olden days, people also used to say that the good girls, go fibroids, the bad girls go babies.
Because the bad girls did it first.
Exactly.
Okay, so the fibroids grow in the uterus. Is there any connection between estrogen and fibroids?
Yes and no. Yes, in the sense that we know that fibroids actually develop during the reproductive age group, and this is when you have estrogen and progesterone levels, high in these women. And when women undergo go through the change, that's menopause, you find that it's rarely that you have fibroids developing. And if anything, you find that existing fibroids tend to shrink. So there must be, a role for estrogens and progesterone in fueling development of fibroids.
Okay.
But if you look at women who have fibroids and those who don't have fibroids, there is no significant difference between the estrogen levels in both groups. Yes.
Okay. It has been said that these fibroids are symptomless, but we can't run away from the fact that women are terrified of fibroids. The average woman, when you talk about fibroids, it's like you brought a curse upon her. Is there any reason to be scared?
Well, majority of fibroids are symptomless, like you said. Majority of them are innocuous. They don't cause any headache. So it is possible that many people have fibroids and they don't even know. And the first time they know is either when they are having a routine physical examination or a routine ultrasound scan for other reasons, for insurance purposes, for pregnancy and all that. But it's also true that fibroids can be associated with certain clinical symptoms. The major ones are delay in fertility, and then the other is menstrual problems, particularly heavy menstrual bleeding. Rarely there could be association with pain. Of course, abdominal distension is also...
I wanted to talk about this abdominal distension.
Yes.
Now, this woman, on a normal day, is either pregnant or has fibroids.
That's correct.
But we don't usually see this, do we?
Yes.
Now, in this situation, would she be going through pain?
Again, fibroids can achieve a normal size without necessarily giving pain.
Okay.
But again, in the course of time, it's possible that certain changes occur within the fibroids called degeneration that may result in pain. Or if you have a fibroid on a pedicle that gets twisted, that can also
it's like pain. On an extension.
That's correct.
Like a flower or a tree. It has a stem. That's what you call a peduncle, right?
That's right. So if that should get twisted, then the vascular supply to the fibroid becomes compromised, and then pain results.
But shouldn't that make the fibroid shrink and die?
Well, not necessarily. Not necessarily. But the immediate thing that the woman will present with will be pain.
Okay. Now, many people have said that if a woman has a fibroid and she gets pregnant, then the fibroid is going to be growing along with the baby. Is that true?
No, not really. I think there are a lot of myths that are associated with fibroid and pregnancy. I've seen concerned women who think that, the presence of the fibroid may either crush
or
the baby
stifle the child.
Yeah, that's usually not the case. The uterus has the capacity to expand, and you usually, on ultrasound scan, you can demonstrate that the baby is growing normally, and is well cushioned within his own compartment, while the fibroid is just there on one side. So occasionally, you may have increased growth in fibroid side during pregnancy as a result of the estrogen output. But it's also the case that sometimes you have the so-called degenerations that may give pain during pregnancy as well. But the other way that fibroid could affect pregnancy is that because of the mere presence of the fibroid, it may affect the way the baby is positioned, and sometimes may prevent the head from dropping in, that is, from engaging.
So in such a case, the fibroid has to be dealt with?
Well, the fibroid, not really, because dealing with fibroids during pregnancy, it may not be a wise decision to take. But it will mean that the baby may have to be delivered by cesarean section. The uterus is very vascular, that is, has a lot of blood supply during pregnancy. Doing a myomectomy, that is, removing fibroids, even outside of pregnancy, is relatively a bloody procedure. So, but even more so in pregnancy, it can be associated with a lot of blood loss.
That's why we're not having any pictures, because some people may become nauseous seeing those things. Yeah. Now, fibroids are symptomless. A lot of fibroids are symptomless, but are they dangerous?
Fibroids,
life-threatening, for example?
Themselves, like we said, a lot of people even have fibroids they don't know. And therefore, those fibroids don't necessarily need any attention. Some may need to be watched over time. So there are benign tumors, and it's not every fibroid that must be removed or dealt with. But occasionally, some of them cause trouble. Like I said earlier, either associated with delay in getting pregnant, or associated with recurrent pregnancy loss, or associated with excessive menstrual bleeding. And like the woman that you showed, nobody likes a big tummy, carrying a big tummy around without being pregnant. So abdominal distension can also be a reason to want to deal with them. Very, very rarely, fibroid, can undergo what we call malignant change. But this is very, very rare indeed.
Okay. Now, the fibroid, how is it treated, assuming it needs to be treated? Or let me first ask you, when fibroids are discovered, maybe you happen upon it, because since most of them are symptomless, you might find out during some sort of examination. When they are discovered, is it something you to actually watch over time, like glaucoma, or something you don't bother about until the patient is reporting symptoms?
Yeah, thank you for the question. Yes, we said the majority of fibroids, they don't cause any trouble. Okay, so majority can simply be observed and watched over time. Okay, if they are not causing any problem, then they should be left alone. And if there seems to be an association with the presence of the fibroid and say infertility, for instance, you need to have a good discussion with your gynecologist, to assess, whether this is actually the reason why there has been a delay. Because the mere presence of the fibroid may not necessarily be the reason why, you're not getting pregnant. It may just be a mere association, a mere coincidence. Okay, so that evaluation needs to be thorough. And of course, if the evaluation has been done, then things can be put in proper perspective. In most cases, for those who, for instance, are seeking fertility preservation, that is the women who have fibroids causing them symptoms, but who want to maintain their fertility, they want to have babies, then a mammectomy will usually be recommended, which is to remove the fibroids. Now, there are many ways of doing it, but by far the most popular is the open surgery. We also know now that increasingly we're using keyhole approach, minimal access surgery to remove
less invasive
fibroids. Yes, less invasive, approach. Now, you may also have heard about medical treatment of fibroids.
Like with tablets or injections?
Yes, like with tablets or with injections. There are tablets that you can take that, for instance, can eliminate or reduce the bleeding, in those who are having problems with heavy or excessive bleeding. But what tends to happen is that what you're doing by doing that is that you are suspending ovarian function. You are suppressing
with those treatments.
Yes, and therefore it may not be possible for the woman to conceive.
So if a woman is planning to have babies, that's not the best way to go?
No, unless you are using it as a temporary measure while you prepare to remove the fibroids. Okay. Now, the other thing, like unorthodox
means of removing it.
Treatment.
We'll reserve that for part 2.
Let's
take a short break. When we come back, we'll talk about unorthodox methods. Okay. Stay with us.